Here we go. Marketing under a lockdown. Thank you, Barry. So before I get into marketing under a lockdown, about 20 to 30% of you who have a boot camp ticket here today with us, you are existing clients of ours, which means I know you know the lingo that I'm going to be speaking about the rest of this boot camp. But for the other 70, 80% of you, you're not a coaching client and you haven't been through the Hurricane University yet and studied with me as Professor H and had your workbooks and filled it out and taken your filing. You haven't gone through the courses yet with me. So I can't teach you this just yet without one basic information first. So I'm going to come over here. All right. All right, so everybody can see me over here now. I'm away from the computer screen and television for a second. And I want to write down some basic information. This right here is what I call the formula for success, which means this is the activities that we have to do from a marketing standpoint to get the referrals that we're after. Because if we don't have referrals, we don't have the freedom to run our business, and we can't do the things that we need to do to be able to grow and scale and so on. So let's go over here real quick. $35 to $45 F2F. This right here is for full-time marketing representatives. If you are a full-time marketing representative, you have to speak to face-to-face, that's what the F to F stands for, face-to-face. You have to speak to 35 to 45 people in person, in the flesh, face-to-face, every single week. Now, I know during this pandemic, that has been near impossible for those of you who are not working with us, all right? If you are a part-time marketing rep or the business owner who does the marketing yourself, which there's a lot of you on this boot camp, as I looked at the survey that came in, a good like 35, 40% of you are business owners who do the marketing yourself. You have to see 15 to 25 people face to face every single week. Now, to this person, the business owner who does the marketing, him or herself, to make sure that you're able to afford a full-time marketer, this is why I have you do this. So what you have to do is you have to see you have to see 15 to 25 people face to face every week to develop the relationships that are going to give you the referrals and then the revenue until you grow your business to a point where then you can afford to hire a full-time marketing person who's going to continue in where you left off. All right, so that's how that works. And when do I recommend hiring a full-time marketing rep? It's when the business is doing over $1 million in total revenue. When you're doing 7 figures a year in revenue coming in, that's when I like to recommend hiring a marketing rep, because then I know you know how to market. You can help train the person that you hire and hold them accountable to the accounts that you've developed. And I know that you can financially afford to have that person on board with you, and you don't have to worry about covering salary or overextending yourself. I like to keep my business owners very financially healthy. If the business is financially healthy, the business can grow and expand. If the business is financially weak, like if you can't afford to spend $100 on a lunch and learn, that's a problem. If you can't afford to spend $10,000 a year on your marketing effort in total, that's a problem. You need to generate more business first, and then you can bring on your marketing rep, etc. So that's the first part of this. So then you're going to add to it. So we're going to build upon it. Plus 1N. 1N stands for networking event. Every week, we have to do some kind of networking event, because this is where we're going to get a lot of these face-to-face contacts. This is where you can start to develop what I call power partners. This is where you can get your first impression and your first meeting with somebody who works at a potential referral source. This is why we have to do this every single week. Plus 1 CE, which is a community event. One community event every single week. So you have your networking events. A networking event is straight networking. You're there for the purpose of networking. A community event could be like a wine and cheese tasting at an assisted living, or a dine and dash, or a drive-through CEU, which a lot of people are doing now. We're going to get into, I'm going to give you so much content in this first session on marketing that you're going to be like, where do I begin, right? Another CE event could be like a church function. If you belong to a mega church, there's some mega churches in your area with like 1,000 members, and they're doing like a community day. You want to participate in that? That's a community event. If it's like in my town, Manalapan, that I live in New Jersey, we have what's called Manalapan Day. Well, Manalapan Day is where all of the businesses in Manalapan get together, and the 50,000 people that live in Manalapan, half of them show up, and we're at the rec center, and it's absolutely amazing, and they have games and singers and music and all types of stuff for the kids and the carnival rides. Yeah, you want to go to that type of a function, and so that is what a community event is. Plus 1. L&L. One lunch and learn every single week. Now, don't worry, I know you can't get lunch and learns right now. My clients are, and you will after I teach how to do this. But you got to do a lunch and learn every single week. It's the only time where you have an audience of people who are there for the sole purpose of hearing about your business and how you can work with them and get referrals. So you have to do this once a week. That's 50 lunch and learns a year. Budget about $100 per lunch and learn, that's $5,000. This is what I was talking about a little while ago. It takes money to make money. Plus 1 SA. 1 SA stands for sponsored activity. Every week we should be sponsoring an activity at a nursing home, at an assisted living, at a skilled nursing facility, at an LTEC community, at a CCRC, at an adult daycare. Every week we need to be sponsoring some kind of activity for the residents, for the people who come and go there. This is how we work with our referral sources. This is how we get into the account and develop a working relationship that leads to referrals. So you do all of these things every single week. This equals success. That equals success. When you do all of this every week, that's going to get you the referrals that you're after. Anything less than this, you're going to fall short. It's like one of those things where you can't, if you give 99% effort, you're going to get like 10% return. But when you give 100% effort, you get 100% return. This is bulletproof. This is non-negotiable. Now, the good news about this, though, when you go to a networking event, you might speak to 10 people. That's 10 of your face-to-face contacts. When you go to a community event, you might speak to 5 people. That's 5 of your face-to-face contacts. When you go to a lunch and learn, you might have 7 people there. That's 7 contacts. And then a sponsored activity, you might get 3 or 4 people at that, right? So this activity right here, just doing this, is good for like 20, 25 of the face-to-face contacts that you need to have every week. This is why for my owners who do the marketing, and we have many of those, it's attainable, because if I do 4 things a week and say each one takes about 2.5 hours to complete, maybe 3 hours, you're looking at 10 to 15 hours worth of work marketing to bring in the referrals that you need. And then my full-time folks, yeah, you could do a lot more than this. This is just the tip of the iceberg. And many of my best, most successful marketing reps, they're not seeing 35, 40 people a week. they're seeing like 60, 70 people a week face to face because they're doing multiple every week. They're doing several lunch and learns. They're sponsoring several activities. They're going to community events and conducting their own community events. They're going to several networking events, and they know what to do at these events through having gone through the Hurricane University program. So this right here, now that you understand this, know what it takes to do from a direct referral marketing standpoint, and now you understand the terminology, now I can teach you how to market during a lockdown, during this scenario right here, right now, and get the business that we're after. All right, so now we turn the camera over here. Bada bing, bada boom. All right, so moving forward in it, this is what we're going to go over. We're going to talk about how do you get these face-to-face visits. If I can't get into an account, if you're stopping me at the door, how am I supposed to see 35 to 45 people every single week? That's going to be a problem. Events and gatherings. What are the kind of events and gatherings that we should be doing right now? What are some events and gatherings that we can coordinate and plan for the fourth quarter of this year? I'm going to go over all that with you. Lunch and learns. We still have to do them. How do you go about doing them? And how do you get them to be successful so that it leads to getting the referrals in the business that you're after? All right, and then we're going to do a closing, and then we'll move on to the next session. So as we continue to jump into it, the first thing you got to do is get these face-to-face visits. I've already talked about it. A phone call, an email is not enough. The reason why so many marketing representatives and business owners are on this boot camp right now is because you've been calling people and it doesn't work. They don't call you back. You've been emailing people and it doesn't work. They don't call you back, right? Or they don't email you back. You stalk them on Facebook and LinkedIn, and you know, you make that friend, hey, how's it going? I'm so-and-so from blah, blah, blah home care. And then they unfriend you, right? Or they don't respond to your messages. And it's really, really frustrating. Like, how am I supposed to get these face-to-face contacts if I can't see anybody? If this pandemic is happening? This is where we have to start off with the face-to-face contacts being virtual. And I say start off because it's an intro to eventually getting your face-to-face, and we'll leverage it. Now, how do we get virtual though? Like, do I FaceTime? You can definitely FaceTime if they'll FaceTime with you, but they're not going to FaceTime with you when they don't know you, right? Because it's all about know, like, and trust. They will FaceTime people they like. They will FaceTime people they trust. They will not FaceTime someone that they don't know. They got to know you first and get to like you. That's when all of that type of stuff will start to pick up and you can get your referrals that way. So initially, what I recommend you do is go on to the social media. Find out who all the key contacts are in the referral sources that you're trying to get into. Meet with one of your power partners face-to-face. Go to Dunkin' Donuts and sit outside on the chairs that they provide outside. Like, be safe, be smart. We're in a pandemic, but life goes on. We're in a pandemic, but business still has to be conducted. And we are healthcare. So being healthcare, we have to make sure that we continue to diligently put in our time and our effort. Meeting people for a cup of coffee at any coffee shop around the country is a very doable, realistic, safe thing to do. So you meet with the power partner. You meet with a contact that you already know, or you get that first person to meet with you and pick their brain. This is exactly what I did when I started Hurricane Marketing Enterprises in 2012. I went down to Florida, I went online, I researched all the accounts that I thought would be good for me to go to for business. And then the company that I was working with, they didn't have many partners. They had like 2 partners. So I said, call them, let's go out and meet them for lunch. We went out, we met them for lunch. And at that lunch meeting, I had my list of accounts that I was trying to get into. And I started asking them, do you know anybody who works here? What contact? What is their name? Do you have their email address? Do you have their phone number? And they gave me everything I needed to get started so that I could then, if you put it to today's time, you have this meeting, and then you get all these contacts and contact information, and it may only be like 10 people, it may only be 5 people, but that's a start. You start there and then you build it. When you meet with that person, then by the way, as you're talking business, who else should I reach out to? Who else should I know? And then they start giving you other contacts, and then you do the same thing that you did to get with this person to get with those people, and then you build. It's like a domino effect. One build upon the other, and then you start getting the business that you're after. All right, so that's the first part of it. Now, with getting virtual, here's what I recommend you do. I recommend you make videos, customized videos for each and every single person who you're trying to speak to. When you make a video, it's more personal. You can't send an email. Everyone is sending emails. You can't make a phone call. Everybody is making phone calls. They have no time. They are stressed out like no other, and they don't want to talk. But if you make a video, it's going to stand out. It's going to be different than what everybody else is doing. And I know it sounds crazy, but if it wasn't for the fact that I've already had hundreds of other marketing representatives and home care business owners do the same exact thing, and I did the same thing myself, I'll show you in a minute, it works. You'll get responses because you're doing something different from what everybody else is doing. I want you to write this down. Gotta get something to drink, my protein shake over here, okay? I will do today. Write this down. I will do today what others won't. I will do today what others won't, so that tomorrow I can do what others can't. I will do today what others won't, so tomorrow I can do what others can't. Most people will not make videos, which means most people will not get referrals tomorrow. You make the videos now, tomorrow, your future, you will get the referrals that you're after. And that quote was Jerry Rice, greatest wide receiver in football ever. Jerry Rice said that. Today I will do what others won't, so that tomorrow I can do what others can't. First part of making a video, download Zoom. It's free. Many of you already have Zoom. I actually have the paid version of Zoom. This might actually be my last time using GoToWebinar for any event going forward because I like the Zoom. It's so much more user-friendly than GoToWebinar, and the technology is more advanced. Download Zoom. I make my drink with the hurricane videos on Zoom now because it's been easier to do it with the social distancing and such. So Zoom is the way to go. When you download Zoom, you want to record yourself on camera. You can have your webcam on your computer. You can get a nice webcam. I have a really expensive webcam I spent hundreds of dollars on. I think it was like $350 or something for a Logitech one. So it's fantastic, but you can use the regular one. It doesn't have to be high tech. You can even use your cell phone. If you have an iPhone or an Android phone, you can use your cell phone and record it on Zoom and save it. You want to make sure it's converted to an MP4 format. Write that down, MP4. I know, and it's so funny when I say this, right? I'm going to say anybody like 40, 45 and younger, you're like, duh, converted MP4. Like, I already know what this is. But then everybody over 45 is MP what? Right? Maybe 50. So I have to, we were all ages here. Some of us are probably in our 20s and 30s, and some of us are in our 50s and 60s and 70s, and maybe even 80s, right? So an MP4 format. What an MP4 format is basically it's a video file. And it's saved on your computer. And I like the computer. I know I mentioned your cell phone, but I like the computer because it's not moving. You can control the sound in the area. Many computers have a better microphone than the microphone in your phone, so the audio is going to be there. If you want to make the quality better, and I want you to remember this, audio, the sound is better and more important than the video quality. If people can't hear your videos and understand what you're saying in the videos, it's not going to come across the way you need it to. So audio is more important than video quality. I did it like that so you could all hear me. So with that said, invest in a good microphone. This microphone right here was about $60, all right, and I have it connected to my computer and I use it for all of my classes and everything else. And then I told you that camera was a couple $100. I think it was $350 for the camera. And that camera has a good microphone in it too, but this microphone is even better. It allows me to do more things. It sounds clearer. It's got the muffle on it. I know you all just heard that when I scratched it, but it's got the little foam muffle on it. So it's a much better quality, and it's a directional mic. So if people are talking behind the camera, you can't hear them. You only hear me because the microphone is directed at me. And I know how to project. I'm a professional speaker, right? So this is what I do. This is who I am. But this is what you want to do. Now, the other reason why you want to use Zoom, and I want you to do this, is because I know that every person in the world is either an extrovert or an introvert. You're one or the other, and to a varying degree. There are some introverts who are like, I can make a video, it's one-on-one, it's me, I can do it. And then there are some introverts who are probably freaking out right now. He wants us to make, can you hear us? Okay, move it back a little bit, okay. So, you know, some of you introverts probably freaking out. Oh no, he wants us to make videos. It's okay when you make the video, because once it's saved, you can watch the playback. And if you don't like it, delete it and make another one. No one sees the final video until you decide when. So if you're nervous about making a video, that's okay. When I made my Drink with the Hurricanes, when I first started, I'm a good speaker. All right, I'm much better now than I was then, but I was a good speaker then because I had already done hundreds of lunch and learns and been to thousands of networking events and met with thousands of patients one-on-one. So I already had a lot of speaking under my belt. But when I first started doing Drink with a Hurricane videos many years ago, I was nervous and I messed them up. It would take me 7 to 10 shots to get one video. Now, if I mess up a video, because I do so many of them, I'll do 4 or 5 straight through without having to need a second take, because I do it all the time. The same thing will happen to you. Being good on camera, recording yourself, is a skill that can be honed and learned. You have the time, take the time to get good at it now. So my extroverts, you're probably like, yep, got it, no problem. Move on to the next slide, Steve. But for my introverts, you're probably like, practice, delete, practice, delete, practice, delete, practice. Ooh, this is a good one. Save it. And then you go on to the next. Now, here's how your video should go, and here's what should be in your video. If you remember back to when you were in 2nd grade, you had the 5-paragraph essay. And the reason why I know it was 2nd grade is because my daughter Sydney was in 2nd grade when the pandemic hit, and I had to teach her how to write the 5-paragraph essay, which is what I actually used way back in 2012 when I started Hurricane Marketing Enterprises for my videos. So all of my videos kind of go in that format where it's like an introduction as to what we're going to talk about and a greeting, then like the topic, and then I go into like 3 supporting documents or 3 paragraphs, and then I close and I end the essay. Well, the same thing goes with the videos. I want to have a quick introduction, introducing myself, who I am, what we do, what we're trying to accomplish. I'm going to make sure that they're safe and sound and they're good and they're not affected by the pandemic. I'm going to share something personal between the two of you. If this is somebody that I have a relationship with, then I'm going to share a story or a memory of something we did in the past before this pandemic began. If I have no idea who they are, then I'm going to share something personal about myself that if you knew me really well, you would know X, Y, and Z. And that's just a way to just make it so that it's more than just sending a please refer me video. Then you're going to promote your company, and you're going to really be promoting something that you're going to be doing, right? Remember that bottom line, the community events, the sponsored activities, the lunch and learns, networking. You want to share something like that so that this way it encourages them to come meet you face to face in person. And then last, you want to say goodbye. And so I'll make a quick example of how to do this right now. So I'll come over here. Hi, Jennifer. This is Steve the Hurricane. I'm the president and owner of Hurricane Marketing Enterprises. How are you today? I'm just making some videos right now to introduce myself to people that I've never met because I can't go out and see people face to face. And first and foremost, Jennifer, I want to make sure, and it is my hope and it is my prayer that you and your family and your friends and everyone that you love is safe and unaffected from this pandemic. And if anybody is or you experienced a loss, my condolences and my thoughts and my prayers are to you and your family during this time. I also wanted to just let you know, we are a home care company in the area, and something that a lot of people who know me know, they know that I am an avid New York Giants football fan. I love the Giants. I watched the game on Monday night. Yes, they lost, and it's okay. They looked so much better than they did last year, and I'm hopeful that we'll have like a 7-9, 8-8 season this year to build upon for next year. And speaking of my company, Hurricane Marketing Enterprises, we are sponsoring a blood drive next month. The blood drive is going to be held at Central State Medical Center, about 3 or 4 miles away from our office. So if you could come and donate a pint of blood, it could really help us to save lives during this crisis right now, because people aren't giving blood the way that they used to. There's a national shortage. So I hope you can join us. Well, I just wanted to send this message real quick because I didn't want to email you. I didn't want to call you and bother you. But I hope to see you at the event. Again, I hope you're safe and sound, and thanks for taking the time to listen to this video. Take care, and God bless. That was so awesome, wasn't it, right? I just made that up. I don't even know who Jennifer is. And all the things I just said are all very real, true things. That's how easy it is to do these videos. Now, again, I'm an expert. I do videos all the time, but that's how you do this video that you're going to be sending out. And you're going to do a video like that for every single contact. So if you don't have any, if you can't get into any places, you got to do 35 of those videos. That's going to take you like 2 full 8-hour days to make that many videos, but that's what you got to do initially to start getting people to come to things that you're going to, where you'll get your face-to-face in person. So this is short-lived, and you may do this like maybe once a month as part of your routine, or people you haven't seen in a while, make another video and then send it out to them. But you're going to be doing this consistently until things loosen up. It'll probably be the next 8 to 12 months before the full doors and all the healthcare places are completely open the way that it was beforehand. So this is embracing the change. But when you do this, this leads to results. Now, the next part of it, now that your video is saved, before you send it, you can't just send the file because the video file is too large. You have to put it on a hosting site first. And there is no hosting site better than YouTube. So once you get the video saved, you're going to have to create a YouTube channel. Real easy, and it's free. It doesn't cost anything to create a YouTube channel. You're not creating these videos to become YouTube famous. Even when I created, by the way, I have hundreds of thousands of followers and videos and likes. It's incredible. I go to airports and I go to restaurants and people know who I am. And my wife and my kids, my wife is so tired of it. She thinks it's hysterical. She's like, oh, another fan, right? And I'm like, honey, I love the people, right? I love the people. But my kids think it's awesome. And I was with even my marketing people. We've been traveling over the world these last 8 years. And I've been at airports. I've been in an Uber where the Uber driver's like, you're Steve the Hurricane, dude, you're awesome. So, you know, I didn't create this YouTube to become a celebrity, but that's like a byproduct, right? But that's not why you're creating this. You're not creating it for that purpose. You're creating the YouTube channel as your hosting site, because once you create the YouTube channel and you put all of your videos on YouTube, then you don't have to send a massive file to somebody that they can't open and see your video. You send them a link to view the video, and everybody can view YouTube, even on their cell phone or on their tablet or on their computer. Everybody can view, and that's what happens. Also, think about when you're sending an email to somebody at work. If you send an email to somebody at work and it's got a video embedded in it, you know it's going to get blocked and they're not going to be able to see it. But you can send an email to somebody with a link. They may not be able to watch the video at work because it might be YouTube might be one of the blocked websites, but they can then forward an email to their personal email and they can watch it later, or they can watch it on their cell phone. This is why you want to upload it to YouTube, so that it's a hosting site that everybody can view, and you don't have to worry about somebody not being able to see your videos. So once you have it, the channel, you upload the video to YouTube and it's saved there. Now, as you're saving it, there's a bunch of different options. One of the most important ones, you're going to get to where it says choose a thumb. A thumb, for those of you that don't know, a thumb is basically the image that people will click on when the video is paused. So like when you upload YouTube, you go to YouTube and then you'll see there's a video there. The video doesn't start to play. You have to press the video, or you have to press the little play button to make the video play, but there's a still image there. I always say choose a custom thumb. We have custom pictures for my Drink with the Hurricane videos, because if you don't, you might have YouTube will choose a thumb for you, but it'll be a specific moment in your video where you might look dumb, right? For lack of a better, like you might look dumb in this video. So you might be like, as I'm talking to you right now, and then all of a sudden the video just stops and it's like, and so you see the way my face was? I'm like, and that could be the thumb. And I personally, I don't care. I'm not vain enough to care that if my thumb looks stupid, that's fine. But some of us might, and you may want it to look a little bit more professional. So you may want to put a headshot or your company logo or something like that as your thumb, so when people go to click on it, they see the logo and then they click on it, and then it's a video of you introducing yourself. So that's something you could do, and you can choose that. It's real easy. It's one of the options on YouTube when you're uploading your video. Save it as an unlisted video, not a private video. Private videos, some people have a hard time accessing and watching private videos. You don't want there to be any issues watching your video. You want people to be able to watch this video, and it should be perfect and it should be great. So save it as a unlisted video. That means that everybody who has the link can watch it, but you can't just find the video or stumble upon your video. So nobody's going to see it except for the people you give the link to, and obviously yourself. All right. And then last, share the link with the key contact. I've already talked about that. Email them. If you have their cell phone, text it to them, and use this as your face-to-face visit initially. Because if you remember, as I go back a slide, right, you're trying to invite them to something. You're inviting them to one of those things that you're going to be doing or you're going to be at, so you can get the face-to-face, in-person meetings happening frequently. All right, so that's how we're going to handle that 35 to 45. And don't take my word for it. All right, like you may think to yourself, like, all right, Steve, that sounds good, but I did this myself when I first started. This is a screenshot, and I did not choose custom thumbs. Like I said, I don't care. So you see, like here, my eyes are closed and my fingers blurry. Here, I'm looking off camera. Here, I got a cheesy smile. Here, I'm probably not even, like, I don't even know what I'm doing here. I don't know what I'm doing. So again, these are all pictures of me, and then every one of them, unlisted, unlisted, unlisted. And you can see only 4 views, 2 views, 8 views. The reason why I went 8 views is because I know when I made it, I said hi to their staff because I know their team. So I sent these videos to my mastermind clients when everything first got started, just to share some inspiration and some love. And you know what was so cool about it? I taught them how to do this, and then they all sent me back videos. And it knowing that somebody took extra time in their busy day during a pandemic. This was during the height of the lockdown, sometime in my guess is like middle of April when I sent these out. It really resonated. It wasn't a phone call, it wasn't an email, it was a video that I took the time to make, and so everybody watched it. And they're not long, 2 minutes, 2.5 minutes, minute and a half. These are not long videos. They shouldn't be. But the fact that I took time to make it is why I got the results and the return that I was hoping for. And the same thing will happen with you. Your referral partners will be appreciative. They'll call you, they'll email you, they'll respond, they'll go to the event that you invited them to, and that's when you take the relationship and you move forward. What I'm trying to do all throughout this session right here and the next 2 days, really, I'm trying to give you ample opportunities to talk about your business, ample opportunities to develop that trust relationship that leads to the referrals that you're after. This is a great seed, because if you remember, I talked about this, know, like, and trust. This will get them to know you real quick, and they might even go right to liking you because you took the extra time, because no one else is doing this. I will do today what others won't, so tomorrow I can do what others can't. Exactly. So now we're moving on. Next, events and gatherings. We have to be going to events. We have to be collaborating and sponsoring events. Events are where it's at. People are tired of staying indoors. People are tired of, especially marketing reps. Like, think about who goes to all these are marketing reps. So not you, not home care marketing reps. You're the people I'm training. Your referral partners, the referral sources, those marketing reps, they're used to going to events. They're used to going to all of the different activities and gatherings and networking and they're used to that stuff. These type of things have made a huge comeback, and everyone's keeping social distance. Everyone's wearing masks. You probably have logo printed masks. I have logo printed masks. I'll put one on later on. I'll show it to you. You probably have those. So go to the events and gather people to these events. You need to be doing these events yourself, all right? But I want you to remember one thing about the events. This is super, super important. When you do these events, and everything that I'm going to go forward on for the rest of this session right here, your goal is to boost morale. Boosting morale. That's what you're trying to do. That's what we have to do, because I want to just paint the picture for a moment of what is happening in our referral sources. Think about the hospitals. Think about the rehab centers, the nursing homes, the assisted livings and independent livings, the continuous care retirement communities, the adult daycares. All of these places where you have residents that are living or going to get care and treatment. As it was prior to 6 months ago, it already was a delicate place, because you have people who are elderly, who are moving in, who are getting help, and people pass away, and there's definitely like takes a special person to work in a lot of these places, and they love their residents. When you think about assisted living and CCRCs and independent living, they love their residents because they see them all the time. And you think about your own grandparents and great-grandparents, those of you who've known them. For most of us, you have a good relationship with your grandparents, and they love you. So imagine you work at a place where there's 80 of them, and they're nice to you, and they talk to you, and you have those couple of buddies and stuff. Enter COVID-19. The most susceptible population are the elderly and people with pre-existing underlying conditions who are also the elderly, right? Here in New Jersey, my state where I'm located, our state had the second highest death total from COVID-19. About 16,000, 17,000 people died. Out of that 16,000, 17,000 people, like 6,000 to 7,000 of them were people who were living in nursing homes. They said that in our state, of all the people in the whole state who live in a nursing home, 30% of the seniors died. 30%. So I want you to think for a second. Imagine you work in that nursing home and you had 100 seniors living here and 30 of them died in the last 6 months. Morale is low. They're upset. They're mourning. They are depressed. They have compliance and protocols and procedures, and they update every single week. You get used to this. Nope, nope, nope. Now you got to do this. Okay, this is how we do it. Nope, nope, nope. Now you got to do this. Now you got to wear this. They're all wearing equipment. many of them are wearing gowns and shields. Like, this is how they go to work every day for the last 6 months. Believe me, nobody wants it to go more to the way that it was before than these folks. So when you do an event, and the reason why you're doing an event, yeah, you're gonna get the business and you wanna get the business. You gotta remember, you're there to boost their morale. All of my clients these last 6 months who've been doing the events, and I'm gonna be sharing with you now how to do these events, every single one of them has told me after they do it, they're first like, well, I don't know if I'm gonna do it. Then they commit, we get them to do it. And when they do it, they all come back and they're like, Steve, the administrator came out and was like, thank you so much for doing this for us. We're all depressed, we're all stressed out and at each other's throats, and you gave us a taste of normalcy, and we are so grateful for it. As a matter of fact, I'm going to show you something. Just last night, I got a text message from one of my clients down in Gainesville, Florida Gators, right? That's where the university is. And she sends me this message, right? And I'll read it. Christina, Professor H, sorry to bug you so late, but I am so pumped up about this. The executive director of the Village just left us the best review on Facebook. Everything that you've been saying 10 times in writing. The proof is in the pudding. This stuff works. And then here's a picture, a screenshot she sent me of what the administrator of the place said. Incredible, caring, compassionate leadership and company, always giving back and supporting our community. I'm telling you, it works, and they're getting a ton of business. She went from being the number 10 franchisee in her franchise system to being the number 3 over the last 3-4 months working with us on the program. She jumped in her franchise, right, by doing these things, and she's boosting the morale. The people, when she shows up, they're happy. This is how she's getting the face-to-face contact. They're happy to see her when she shows up, and everybody comes outside and she does stuff. So remember that you're trying to boost the morale for your counterparts who are really down and in the dumps right now because where they work is so affected. Even if they didn't have a lot of cases, they're still affected by what's happening more than anywhere else on the planet. So check these out, all right? And you all have this when you downloaded it. This is an ice cream social that one of my clients did in Princeton, New Jersey, all right? And if we notice this, she's not paying for it herself, all right? Ann did this. Her company, Aiken Care, and then she got Embracing Hospice to partner up with her on it. What they did was they had it at Halo Ice Cream Pub, a centrally located place in beautiful downtown Princeton, New Jersey. If you ever come to New Jersey, a lot of people go to New Jersey because they fly in and then they go to New York City. But if you ever come to New Jersey, go down to Princeton because Princeton is just absolutely gorgeous. So if you see A Beautiful Mind with Russell Crowe, he was a professor at Princeton University, and there are scenes in that movie that were filmed at Princeton. It is everything that you saw in that movie and so much more, especially at this time of year. All the trees the leaves are turning. It's a beautiful time of year to go down to Princeton. So just throwing that out there. Come to Jersey, go to Princeton, right? Check it out. But so she had a social distance ice cream social, right? And so everybody who showed up, they paid for an ice cream cone. Now, what'd she have? This was June 10th for an hour from 3 until 4 o'clock. What, 20 people show up? $5 for an ice cream, and most people don't even, oh, I don't need ice cream. Oh, maybe I'll get something, right? Most people don't eat it. But even if she had bought 50 ice creams, what's it, $5 an ice cream? So what's that, $250? And you're splitting the cost with another company. That's a no-brainer. It's $125, and you have 50 people show up that you're going to get to meet face-to-face. That's a great idea for an event, especially if you're in an area of the country where it's still hot. I love this one right here, Chalk Way of Hope. So they went around and they drew with chalk, and they had the team, and some of them probably brought their kids. All right. Senior Bridge is the home care company. Bridgeway Senior Care is the assisted living. Two companies partnered up, and they went to the hospital, and they're drawing this down, and they're sending messages of hope to all the people coming in and out. We appreciate you. Healthcare heroes. Heroes, not all heroes wear capes, etc. Rainbows and sunshine and everything. Spreading joy, boosting morale, collaboration, and they invite other people. What does that cost you? For some sidewalk chalk, 99-cent store, you can go to the Dollar General and get some chalk. A spark in the park, all right? Care One is an assisted living community in East Brunswick that collaborated with Van Dyke Law Firm. They had the lady who works at Van Dyke, Shelly Minaccio, happens to be a musician as well. So she coordinated this with Care One, and they had it at a park. And she was playing music, and they had refreshments, and it was outside, and 25, 30 people showed up, and that's a collaboration. It doesn't have to have hundreds of people. It's okay if I've done events over the years, even before there was a pandemic, where I expected to have 20, 30 people to show up, and I had 7 or 8 people to show up. Big whoop-de-doo. You talk to the 7 or 8 people that are there. You get to know them. You invite them to the next thing that you're doing. You book a meeting from a meeting. As many of my clients, you know exactly what I'm talking about. So I'm going to schedule a time to follow up and talk business with you. This is how you get your face-to-face visits. And cool thing, Anne, the lady who did the social distancing, she created to make sure that so everybody felt comfortable. She took buttons. I don't know, it's a button with a pin on the back, so I don't know what these cost. $1 a piece. I don't know, she probably ordered them or whatever. It wasn't a huge expense. And she had a sign. If you have a green button on, high five me, fist bump, you could give me a hug. I'm okay. It's cool. I'm cool with COVID, right? If it's yellow, let's talk, but please don't touch me, right? I'm cool with COVID, I'm cool with coming out, but no physical contact, all right? And then if you got the red, please keep it 6 feet. I'm immunocompromised, or my mother has cancer and I don't want to be a carrier and bring it to her, or something like whatever it is. And no questions asked. Just respect the rules of the event. And she had people show up everywhere. I mean, what a great idea. You can do this. This is affordable, and we all can do this. All right, so just throwing this out there. So Anne, I know that you're watching. Hats off to you, sister. Very proud of you. All right, here are some other ones. Walter, one of our clients in New York, so proud of him. New York City, come on, think back to what happened in New York City, March, April, May, even into June. New York City was ground zero. How many people died? How many people came down and infected with it? It was out of control. It was out of control, out of control. He got a PPP delivery going, started partying with people, and he's driving around to all the places that needed PPE because you couldn't get it, and he was delivering it. That's a great way to boost morale, to give back, to support your referral sources. You're asking for them to refer you. How's about I help you in your time of need if I'm able to do it? He was able to do it, and he reaped the benefits from it. And he was doing it for the right reasons. And his business kind of rode that. He's doing it to help and boost morale, and his business rode the coattails of it, and he got referrals. Minneapolis, Minnesota. Not going to get political, but you all know what happened in Minneapolis over the summer, all right? You all know what happened there, right? This is all part of that 2020 I was talking about. During this pandemic, one of our clients there is a seamstress. His aunt is a seamstress. She made all types of masks that could go over the N95 masks so that it can be reused again and again. They can just wash it. It was such a good thing that they did giving back. This is April 2nd. And it made the local newspaper. And all the publicity, and you can't see the full photo here because I had to shrink it down to get multiple on here. But here's a picture of his aunt, here's her sewing machine, and she made hundreds of these. And they gave it out. You can do the same thing. Ask around your caregivers, ask around your office staff. There are a lot more seamstresses out there than you may realize. One of our clients, Debbie in Florida, who I happened to meet when I was down there for my vacation. I go to Florida every August for a month, and I was thinking about not doing it, and I'm glad that I did, because all I did was sit on the beach every single day, got nice and tan, you know, got to work out a little bit and swim in the Gulf of Mexico every single day and be with my kids. It was fantastic. But we went out for ice cream and we met Debbie, who's one of my clients, and we were talking, but Debbie did the same exact thing. And all of her referral sources loved it. These are things that you can do now during a lockdown, during a pandemic, that your referral sources will appreciate, and it gives you the face-to-face visits. So you're boosting morale, you're helping and supporting them, and your company rides the coattails of the visit and the time that you're there. Because remember, what am I trying to do for you? Give you time in front of people face to face to do what you do best, which is talk about your company and your business, to be able to grow and get the referrals that you're after. Moving forward, this is one of my favorite photos, all right? So I'm gonna go forward one slide and come back. This is what we call a snack shack. A snack shack, a snack wagon. These are all different things that people have called it. In particular, this is Christina, who's one of my clients in Denver, Colorado, who's crushing it right now. Crushing. I think she had like 12 referrals last week. 12 referrals last week. How many of you, raise your hand on the go-to meeting, raise your hand. How many of you would like to have 12 referrals this week? Just raise your hand. I want to see that real quick. Oh, look, people are calling in to tell us that they want to, right? You see the hands going up? Yes? Okay, cool. So what this is, she got a couple coolers, all right? You see they got some cool snacks in here. We got some like pudding snacks. We got some Frappuccinos and stuff from Starbucks, some Uncrustable peanut butter and jelly sandwiches and other snacks. You got some, you know, they got to get the salt with the sweet, right? So you got the Doritos and the Cheetos and all of that. And then you got, I guess this is like fruit roll-ups and fruit by the foot. Do you remember fruit by the foot? I remember fruit by the foot, right? I remember it. Junior Mints. They got Junior Mints. Junior Mints is my favorite candy. So if any of you are like, hey, Steve, this boot camp was amazing, and you want to send us like a card or something, you can totally send me Junior Mints, all right? So I love Junior Mints. But this does not cost a lot of money. $50, $75 worth of stuff. Go back a slide. She went to her hospital. She coordinated this. She shows up between 2 and 4 o'clock in the afternoon. That is the shift change. That is when a lot of people take breaks. And it's planned out, and everybody came out. What are they doing? Social distancing, right? They're all wearing a mask. These are nurses. These are social workers and discharge planners. And she's there for 2 hours, and she gets to meet 20, 30 people who work at that hospital. And let me ask you, like, do you think they appreciate this gesture? Do you think they appreciate just getting outside for 15 minutes, take a break and not have to pay for it? And then they get to talk, and some of them take the cigarette breaks or whatever, and they get to talk to Christina, and she's just there. She gets to know them. And this hospital refers Christina all the time. And we have so many other clients right now doing these snack shacks. They usually do about 3 or 4 snack shacks a week. So think about what I just said earlier. You got to see 35 to 45 people face to face every single week. If you're a full-time marketer, if you're the owner doing the marketing, you got to see 15 to 25 people face to face every week. If you do 3 snack shacks and you see 5 to 10 people in each one, that's like half of what your battle is. And you're gonna get deep in these, and then you schedule time to come back. Come back next week. Come back in 2 weeks. When you have enough accounts, part of what we teach people in the Hurricane University and our coaching programs is how many accounts that you should be managing. So if you have like 15, 20 accounts that you're managing, you can do it once a month in all of your accounts and see every key contact when you come there. And that's developing a relationship. This is why my clients are getting these emails and phone calls and face-to-face conversations from administrators saying thank you for doing this. We appreciate it. And you know what else they're creating? They're creating what I call the "you were there when" phenomenon. And you can write it down. The "you were there when," you were there when phenomenon. And it's when all of this mess is behind us. And it's like 2024, 2025, and God help us, it's not going to last that long. But I'm just saying, 4 or 5 years from now, when you're talking to your referral partner then, and you're reminiscing about 2020, because it's just human nature. The response is going to be, you were there when we went through that, and you helped us out when no one else would. You did everything you could to boost our morale when no one else would. And we are forever grateful for what you did then. When I was a marketing rep back in the day, I did this, right? And I remember the Gardens at Monroe was a skilled nursing facility that was just purchased from the Applegarth Care Center. That's what it was called before. Applegarth Care Center was top 10 worst. Somebody just bought something. That's awesome. We made a sale. Look at that. Applegarth Care Center was top 10 worst nursing homes in the United States. Top 10. They came in, changed the name, changed some of the people that worked there, got new leadership, upped the standard, renovated all this stuff, and they were looking for partners in the community. No one wanted to work with the company that had the reputation as being one of the worst places in the country, even though it was a new company, new name and everything. Still same buildings, still tarnished image. I worked with them when they bought it, and they went through that transition. 3-4 years later, that skilled nursing facility went from being a 1-star rated to a 5-star rated Medicare building. They had 50, 60 discharges a month coming through their doors for rehab, as well as their long-term residents that lived there as well. And I was getting 4 or 5 referrals a month from that one account. One of my competitors came walking in there and said, I would like to work with you. And they said, no, we work with our companies. We have who we work with. And the person started mouthing off and said, this is what the marketing person told me had happened. They started mouthing off, I know you work with Steve. I know you work with his company. We want to work with you too. And she goes, stop right there. When we were looking for partners in the community, nobody wanted to work with us except for Steve. He helped us when no one else would. He was there when no one else was. And so now that we're successful, he is going to get the referrals from us first. And if he can't do it, then maybe we will call you, and turned around and walked away. That's what happens when you do things with your referral sources when no one else will or can. This right here is golden in your efforts to get the referrals that you're after. Moving forward, deliveries, one of our clients in Arkansas, Pansy Cares Home Care, absolutely love it. Remember when toilet paper, you couldn't get toilet paper? Remember that? I have a great funny story that I put on social media about the Costco Ninja and how I basically battled toilet paper zombies to get toilet paper. This is back in April. It was very funny. I had a lot of likes, even the people, even Costco like groups, people who were like, I share this on the Costco group where Costco employees work. Like, it was hysterical. But he got a whole bunch of toilet paper and paper towels, and he was giving them out to his clients and other places that needed it during the time. That's beautiful, right? These are real people doing this all around the country. This is one of my favorite ones. All right, Dallas, Texas, the Quarantine 15 Challenge. You want a reason to come to multiple accounts and come back every single week? Well, if you remember back when the pandemic first started and we had the lockdown, everybody was indoors, right? And when people are indoors, let's be real, that means you're eating more, and you're drinking more, right? I have a wine refrigerator in my kitchen. We renovated our kitchen like 5 years ago, and I have this beautiful wine refrigerator. It holds 75 bottles of wine. My wife and I probably went through at least 75 bottles of wine during that time. Now, I was working out. I stayed fit. My wife stayed fit too, so we're good. But man, oh man, I remember when this happened. This is what I was doing. All right, well, it's 5 o'clock somewhere, right? Pour a glass of wine, we have some wine. Now, so a lot of people gained weight. I went down to the beach, and I'm like, I got my beach body on, my muscles and stuff. It was a stressful time for all of us, right? So we came up with this idea to do a weight loss competition. Now, I did a weight loss competition back in 2006 at the beginning of the year with a whole bunch of my referral sources. So I said, let's try this out. So what they did was they bought a scale. So it was one scale. They had 7 or 8 communities and nursing homes that participated. So now my rep, my client, was able for 8 weeks in a row, she was able to go to these 7 or 8 places again and again and again and again, and everyone who participated came outside to jump on the scale. It boosted the morale, it boosted the energy, it boosted the relationship. Week 1, there's only like 3 or 4 people that participated. Week 2, there's like 5 or 6 people. Week 3, now there's like 10 people because everybody wants to lose weight, and they're like, oh yeah, I'm in that quarantine, and they're seeing this, right? There were some rules with it. You had to pay $5 to join, and then for every pound of weight that you lose, give another $1, and all the money went to the Alzheimer's Association. So they raised money for the Alzheimer's Association. They boosted morale, and they were able to go every single week for 8 weeks straight to their 7 or 8 accounts and develop relationships. Guess what happened in August? They had the most amount of referrals that they've ever had in the month of August in the 11+ year history of this home care company. 11+ years in business, this August was their best referral month ever. And I want to tell you something else going further with it, right? They had a fatal Monday, meaning they lost like 500 hours one weekend, and they completely didn't even feel it because the amount of referrals that came in, they replaced those hours right away, and they're back up to where they were before the fatal Monday happened. Now, every one of us knows what I'm talking about. You've all had that. We have a bunch of clients pass away or a bunch of clients discontinue services, and then all of a sudden, you're like, what am I going to do? I just lost 30% of my business, and it takes you months to recover from it. A couple of weeks, because the referrals are coming in, because referrals equals freedom. Referrals equals freedom. All right, here's a picture, Debbie, with the winners of the challenge when the challenge ended. That is fantastic. Every one of you. And what did it cost her? The price of the scale? You can get a cheap scale at Walmart for $20. So don't tell me you can't do it. I know you can. I will do today what others won't, so that tomorrow I can do what others can't. Do something like this. Have your best referral month ever during a lockdown period. You know what's cool about this too as I move forward? And you see all these are all my clients. I'm not just making this stuff up. The examples I gave you are people all around the country and specifics. I have so many people all around, franchises doing this and more. It can be done. You can do this. You can get the results that you're after when you do it. You're boosting morale. Your referral sources appreciate it. You know what's cool about this? Because you're on this boot camp right now. You're sharpening your axe, right? Here's another scripture. I didn't say this earlier, but iron sharpens iron as one man sharpens another. Proverbs 27:17, right? I am a sheet of iron. You are a sheet of iron. I'm sharpening you right now. You go out there, you start swinging your sharp axe, you're going to get referrals that your competitors can't. Every person, we send all these text messages out and emails, and every one of you who invested in this, there were at least 2 others who were like, please don't, no, I'm not interested, stop, whatever, right? That's what happened. And it's okay, because they're not here learning this. They're not going to be able to do the things that you're doing, which means they're not going to get the referrals that you're after. Because everybody's trying to get into accounts right now, but you can't. Here's the way. All right. And I think I even have more. Check this out. All right. One of our clients organized a parade. Remember when everyone was doing the birthday parades and people were doing parades at hospitals and stuff? Well, one of my clients did a motorcycle parade. So got all the motorcycles together, all the ride. Everybody get your Harley, get your Hog. Steve the Hurricane is a motorcycle guy, all right? I used to ride crotch rockets. I have the M endorsement on my license. I'm a big fan, just saying. Driving around to the nursing homes and the assisted living communities and look at all the seniors out on their porches, woo! Because this forever line of motorcycles going all the way back, and just driving through town, spreading joy, spreading happiness. And they organized it with the motorcycle club that they belong to. And why not? It gives you a reason to go out and ride together, and you're giving back, you're having fun, and that's the motorcycle noise that I was just making. Right? I would be doing wheelies on my crotch rockets, right? So, but this is awesome. This is giving back. And you know what happens? This isn't the only person that we had do this is the only person we've had do the motorcycle rally. This isn't the only person that we've had do parades. We've had many clients organize parades, and they got the police involved. They got the fire department involved. So the police police cars are going by, and the fire trucks are going by with them, and all of their staff. One of our clients went out and got the local high school, and he called it Seniors Caring for Seniors. And it was seniors in high school who were graduating back in June, caring for the seniors who live in their nursing homes in the communities. He went out and got 9 different communities. He had this whole trail there where they would ride around. All the high school seniors who were graduating his son's high school, including his son, showed up, and they were just beeping horns, and it was endless cars. And they went from community to community to community. They had police escorts and fire trucks and everything. And you know what happens to my clients as they're doing this? I'll come back to that in a second. Hang on, I'll show you. They got on the news. All right, this is Tanisha down in Alabama on the news doing the things that I'm teaching you how to do. This is Ruben in Gainesville, Florida. What I was talking about before, Christina's his daughter. She's the one who texted me last night. Got on the news doing those parades. This is Brianne in Minnesota on the news doing the parades and the things that we talked about. This is Tom, Chicago, on the news doing the parade that I just talked about. Do you think they got referrals when you're on the news? Or because you did something to give back? Because there was something positive that they wanted to share? Because everything on the news is negative. Everything on the news is negative, right? It's pandemic. It's protesting. It's political. It's garbage. It's garbage. I hate the news, right? Do something good and get on the news, and your business blows up. You're on the news. You're on the news. Instant credibility. Instant credibility. So let me just jump back. I jumped ahead a little bit. I talked about the blood drive. You heard me say that we're at a national crisis right now, because they're already always at a blood shortage as it is. But now, because people aren't giving blood, because people are afraid, it's like really, really low. Like people are dying waiting for blood because there's not enough blood. Reach out to your blood banks. And the reason why we have this here, vampire blood, right? Reach out to your blood banks. Ask them if they have a mobile truck. They basically, for those of you who don't know what it is, it's like an old school bus that's been retrofitted and customized so that they have blood giving stations in the bus. And they can do 2 or even 1 person at a time. This way it's not endangering anybody. If they say yes, ask them if you could try and do multiple blood drives with them. If they say yes, they're the ones that pays for everything. So it's not, you don't have to pay for it, they pay for it. Then you have 4 places in the month of October. You could do this. You can start setting this up this week. Set it up because October 1st is a Thursday, so don't do it that week. Start the first one the week of the 5th, and all the way through the week leading up to the Saturday, October 31st. And you get 4 places to host it, and then each one of the places that's hosting it with you, you make 4 different flyers with your logo and their logo on it, and then you promote it at all the communities and the rehabs and the hospitals and every place that surrounds the place that's hosting it with you. And you encourage people who work at the place to come out and give blood. And you encourage the residents' families to come out and give blood. And you get, I don't know, 10, 20 donations per blood drive. And so what we're calling, here's what I have this here. You can go to bedbathandbeyond.com, and they have this for Halloween. It's vampire blood hand soap. So pandemic, wash your hands, right? So it's a giveaway. And so what I'm telling people to do is I would love it just to be a nationwide thing, because all of the hundreds of people on this right now are doing this, plus all of our clients too. I'm calling it, I want to suck your blood dry. So it's Halloween, so you put some bats on your flyer and your email invitation. I want to suck your blood dry, right? Good old Dracula. And every person who gives away blood, you give them a bottle of this. And I believe if you look on bedbathandbeyond.com, you can get 6 bottles of this soap for $26. So if you have to buy 100 of them, you know, it's going to cost you $400, $500. It's not a lot of money. It's not a lot of money for 5 blood drives, 4 blood drives. And you give it away, and then you make it happen, and you organize it. And if you get a power partner, you get a hospice or a home health or a private duty, depending on what walk of life you're from, because some of us on here are from hospice, some of us are from private duty, and some of us are from home health. You get somebody else who's from the other parts of the 3-legged bar stool of home-based providers to sponsor it. Now you split the cost in half. And you can even get the community that's hosting it in their parking lot to help you pay for it. So now you're splitting the cost 3 ways. This is not a big expense, but the return on investment is tremendous because you're giving back, you're boosting morale, and you're getting face-to-face contacts that you wouldn't get otherwise, to which, as I'm wrapping up here this session, we're on to lunch and learns. This is how my clients are getting lunch and learns. They're doing all of these things. The administrator comes out. When the administrator comes out and says, hey, Steve, thank you so much for doing this. We look forward to you doing this every week. Man, you are fantastic. Are you getting referrals from us? The administrator, they always ask if you're getting referrals from us, because they want to make sure, like, you're doing all this stuff. No one wants to just sit there and just keep taking it and just be greedy and not give it. Like, these administrators, they know that you're doing this, but you're earning the business. They want to make sure that you're getting it. So they're going to ask you that. And then you could say, well, you know, we haven't really gotten the business yet, but could you help me? Could I get a lunch and learn? Are you open to having me come in? Are you open to having you know, an outdoor lunch and learn? Could I come? Do you have a gazebo outside? A lot of assisted living communities and skilled nursing facilities and CCRCs, continuous care retirement communities. They have a beautiful outdoor gazebo. They have a barbecue grill area. And yeah, you could do a lunch and learn outside. Many of my clients are getting that. And then you can also get people who you deliver food and then you do it via Zoom. All of this and so much more, you can do the lunch and learns. Here's a picture of one of my clients, another different area in Florida, Orlando, Orange County. Bring in food, and this is not a lunch and learn. He bought groceries for the workers there, because back when the pandemic was really heavy and everything was locked down, and you know, you have these people, they go to work. You're in a nursing home, you're in a hospital, you go to work. And then you get out of work because you're working your shift and everything is closed. Or you have to go home to your kids, you know, and then they got to take off their clothes and they got to scrub down because they don't want to get COVID to their family and stuff. So he bought groceries, right? He just opened his business and he's killing it. He's got over 500 billable hours a week. He just opened his business like 6 months ago. He's crushing it in Orlando, Florida, doing everything that I talked about. I'm so proud of Steve and Steve, all right? Father and son team. Very proud of them. I'm proud of all of my clients. That's what happens when we do this. And all the people again who are on the news, you know. And so we're going to end with a quote. Only those who will risk going too far can possibly find out how far one can go. T.S. Eliot. Is it risky? Of course it's a calculated risk, but you're a business owner. You knew the risks of starting a business when you started it. You're a marketing representative. You know the risks involved with starting a marketing position. You gotta get out there. You gotta make things happen. You gotta, and I gave you at least 20 different things and ideas that you could do during this. Pick the one that works for you and run with it. Start off with those videos. Invite people to collaborations and get cracking. Get out there and do it and make it happen. Because when you do, you're going to be like all of these people who I've helped over the last 8 years of my life who've grown and they doubled and tripled and quintupled their business. I know it can be done because I've been doing it for 8 years. I know it can be done during a pandemic because all of my clients are thriving. All you got to do is do a little bit of work. And so, my friends, one more time, I'm going to ask you, are you going to be my next success story? Yes or yes? That's right.